Good morning, everyone. I'm Chinmay and my teammate Daisy Longer. Today we stand before you to present the topic on electromyography, which is known as the EMG. Uh, First, the table of contents. We started with the introduction and then how it works and the types of electrodes and the block diagrams and the action potentials. Then the conclusion and last at the reference which we have used to make this presentation. Now, starting with the introduction, electromyography or EMG is a technique which is used to evaluating or record the electrical activity or electrical potential which is produced by the skeletal muscles. And next, the electrical myograph is an instrument which is used to perform electromyography. It detects the electrical potential generated by the muscle cells when the cells are electrically or neurologically activated. The electromyogram is a recording obtained by the electromyograph in the process of electromyography. This test is used to detect and diagnose the neuromuscular abnormalities. Then coming to next, surface electrode. Surface electrode. It's an electrode those which are placed on the surface or the surface of the skin, and it is used to measure and detect the bioelectrical potential from the surface of the skin, which is subjected to the patient and used to monitor large and superficial muscles or a group of muscles. It is not used in chemical process. Then we come to fine wire indwelling electrodes. It is basically introduced in early of 1960s of canalogical study of small and deep muscles. These are necessary to record single monitor unit potential for the clinical EMG. The electrodes are made up of fine, extremely fine nylon coated strands with the small diameter, which is approx 50 to 100 micrometer. Then coming to the next, needle electrodes. It is a wire which is placed to measure the electrical current, or it is a wire which is used to flow the electrical current inside the muscles to create heat, which is used to destroy the diseased muscles or tissues, and to block the blood flow. It is required for the clinical EMG to record the single motor unit potentials. The first study was of needle electrode is happened in 1929 by Andrian and Brock, uh, who is used to concentric needle electrodes. A bare tip of a platinum. The process is a bare tip of platinum wire is considered to be the active electrode, and the cannula acts as the reference of the electrode. Then comes to the recording EMG, which is divided or used as three-phase system. First one is the input phase that includes electrodes to pick electrical potential from the contracting muscles, and the next step is a process phase. During this, which is the small electrical signals is amplified, and the next and the last at the output phase, in which the electrical signals is converted is visualized or audible signals, so that the data can be displayed and analyzed for the further use of the treatment. And this is the placement of electrodes. First first the surface electrodes, and two are placed in the surface electrodes, and last is the ground electrodes placed to the preamplifier. Then it comes to the amplifier, and then it comes to the recorder, and then we display the EMG recorder. Then this is the block diagram of a digital EMG system. At first, the electrodes or the lead, which is conducting under the leads and cables, comes to the pre-amplifier or amplifier filters, and then it comes to the analog to the digital converter, and then it goes to digital signal processing, which is displayed terminally and printed the storage databases. And then this is the EMG signal at the surface EMG frequency band limit of 2 kilohertz. And now I am transferring or handing over to Daisy to continue further.
So we are going to look at the EMG signal capture. As we are aware, we have been told that there are two different ways of capturing the EMG signal. It can be by using the surface electrodes or the needle electrodes to get inside the muscle. So in EMG signal capture, here we are going to see that you are supposed to input two different points on the muscle which are close together. So it's where you're supposed to look for one type of muscle, and then you input the two electrodes usually along the same line in order to get a good signal. And then the ground electrode is placed further away from that muscle and mostly on a fibrous tissue, so as to get a good signal from the EMG. So electrode alignment with the direction of the muscles increases the probability of detecting the same signal. So the goal is to get the same signal, mostly because we are targeting the same muscle that will give us the same signal. And then afterwards, we are going to subtract the two inputs. So from one electrode and then the other electrode, we subtract, and then what we get from subtracting, we amplify. So that difference is what we are going to amplify. And what we are going to get as the result is the electrical potential that is going to be processed further. So there are different ways of getting the EMG signal, and in this manner we are going to look at the insertional activity of the needle that we are going to insert inside the muscle. So it normally lasts less than 30 milliseconds, like when it is inserted inside, and it can be described as normal, it can be reduced, it can be absent, it can be increased, or it can be prolonged. Okay, so though this depends on if there is any abnormality of the muscle. So for example, if it is absent, it indicates that the electrode is either not in the muscle tissue or that it has gone to the fibrous muscle tissue. So it indicates that if it is absent, it is supposed to be again reinserted. Usually the muscle is not completely, it's not supposed to be completely absent. That is why, in case there is no activity at all, it has to be in the fibrous tissue. So increased or prolonged activity again can be an issue, which indicates the unstable or excitable membrane that occurs when the muscle is actively denervating or inflamed. So when there is any inflammation in the muscle, usually it will give us an increased or prolonged activity. What we mean is, once you insert it, it's supposed to give some activity and then show some electrical silence, and then when you start contracting your muscle, it will give a recording. So in case there is a prolonged activity when you insert it, it shows that there is an instability due to inflammation. So we are going to look at muscle at rest. So what we mean at muscle at rest is, after insertion, usually the normal relaxed muscle will exhibit what we call the electrical silence, which is the absence of electrical potential. Okay, so observation of silence in the relaxed state is important in the EMG exam. It means that there was activity and then we have reached the muscle, and then there is silence, which means there is no contractions going on. Now, potentials arising spontaneously during this period are a significant abnormal findings. So in case there is any electrical recording experienced in this point, it is an abnormality. So levels of contractions are increased progressively to a strong effort, allowing the determination of recruitment processes. So recruitment means how the muscles are going to be fired simultaneously. So once it has been inserted and then we have experienced some electrical silence, the patient is asked to contract the muscles slowly and then with effort, progressively like that. So gradually increasing the force of contraction will allow the electromyographer or the person who is recording the EMG to observe the pattern of recruitment in the muscles. So it is a gradual process where we are going to observe as we gradually contract the muscle. Now, the depolarization process of electrical activity that is manifested as a motor unit action potential, abbreviated as MUAP, and recorded and displayed graphically as EMG signal. So let's look at the MUAP. So the motor neuron stimulation. So when we talk of a motor neuron, it is the nerve and muscle cell that is recruited. Okay. So usually there is stimulation, and that stimulation it is from the brain. Okay. So when the brain sends the signal to a muscle, it sends an electrical impulse down the motor neuron. So usually, when a person thinks is told to contract their muscle, it is the brain that is going to do the stimulation. So from the brain, an electrical impulse is sent down to the motor neuron. Now, when the impulse is when that electrical impulse is sent to the motor neuron, it causes depolarization of the motor neuron, where the cells open up and there is a rapid influx. Oh, and there is a rapid influx of sodium ions inside the muscle cell. Okay. So there is the rapid influx of the sodium ions inside the muscle cell. So once there is a depolarization, action potential propagation is going to happen next, where the depolarization triggers an action potential of the rest of the muscle cells. Now, the MUAP is the resultant action potential generated in the motor neuron that usually spreads across the muscle fibers of the motor unit. So the motor unit is single, and then because of the recruitment or the contraction, others are also going to be depolarized, causing them to contract simultaneously. So this is how the normal motor unit action potential looks like, where we have, this is the duration of the total duration of the action potential, and then there are different phases in this action potential, and then the amplitude of the whole muscle. So the amplitude varies according to the type of muscle. Okay. And now we have the neuropathic muscle motor unit action potential. When you say neuropathic, it means it is there is neuropathy, which means there is disease. So this is how the one that is not normal looks like. And then we have myopathic as well, and this is how it looks like. Now let's talk about the artifact. So the artifact is any unwanted electrical activity, okay, that arises outside the tissue being examined. So let's talk about, maybe we are trying to, for this instance, we are trying to record the muscle, but then we find that there are other interferences from the environment. So it can be, for example, movement artifacts. So when there are unwanted movements, we are going to still see recorded in the electrical, in the EMG, and also the electromagnetic interference from maybe fans, from the AC. It will interfere with our signal, and sometimes also there is what we call electrode popping, where maybe the gel was not enough, and then the electrode popped. So that is what will cause artifacts. And let's look at the applications of the EMG signal. So there are various applications in various fields, and one is the medical research. So EMG is very important to in research to understand various things in orthopedics. It can be also in surgery. It can be in functional neurology, gait and posture analysis. So the research from understanding how the muscle works and how it behaves helps to improve in these fields. orthopedics and surgery. And also there is rehabilitation. So rehabilitation usually is a method of helping a patient maybe recover if they have had problem in their muscles. So it can be during surgery. So post surgery, there is a study of the muscle to understand how it is recovering. There is neurological rehabilitation where there was issues with the nerves and there is no more recruiting of the muscle cell. So it is important to understand the neurology. Also, there is physical therapy. So there are people who go through therapy, especially when their muscles were no longer well functional. So there is also active training therapy. There are people who are doing active sports. So because of that, we have to understand their function, the functions of their muscles. There is also ergonomics, where in the workplace we have to see maybe how the muscles of the workers has been affected. So we can see the analysis of demand, the risk prevention. Maybe there are some things that could pose risk to the muscle, and ergonomics design, and also product certification. We may need certification in some workplaces so that we can certify that you are fit to work. So it is apply, the EMG is important in this manner. There is also sports science, where we are going to look at the biomechanics. So it is basically how biomechanics is the study of with the study of the muscles. We are going to understand things like contractions, so through biomechanics it's important. The movement analysis as well, we study the movement, thanks to the muscle, the contraction and the relaxation of the muscle, and also athlete strength training. So there is strength training that we use also the EMG to understand the muscles of the people in sports, and also sports rehabilitation. In case there was accident before and then the person is no longer, the muscle is affected, we use EMG to understand or to improve and rehabilitate the person in sports. And here we have our references where we basically got our information, and that marks the end of our presentation. Thank you. Any questions? Thank you. Thank you.